Hello, hello, and welcome back to another episode of Anatomy with Alex. My name is Alexandra Ellis from aewellness.com, and on today's episode of Anatomy with Alex, we are talking about knee ligaments. So if you're like, well, what? Let's just start with this idea. Four-time Super Bowl winner Tom Brady, USA Women's World Cup winner Alex Morgan, and Rob Gronkowski all have this in common, and maybe with you too. And this is that they have suffered from an ACL injury. So I'll be talking about ACL injuries, what they are, what the ligaments in the knee are, and what you can do to keep your knees healthy, whether or not you have had this injury or you're just trying to keep away from it. Anatomy with Alex is my weekly show where I share anatomy and physiology with you in ways that are relevant and applicable to your life so that you can start today maximizing your mobility to live pain-free in your body. As always, any questions or comments you have, you can drop them down into the comment box below and I will answer them. And let's just dive right in, all right? So the unhappy triad, this is a very common knee injury, and this is when the MCL, the medial meniscus, and the ACL are damaged. And I'll talk more about what each of those structures are, but there are between 250 and 300,000 ACL and injuries every single year. And they're almost exclusively happening to athletes. So if you are not an athlete, you're like, oh, whew, I'm off the hook. But you probably know an athlete, or perhaps your child is an athlete. And so understanding how the knees are built and how best to stabilize them is really important. Anytime there's a knee injury, that sets you up for potentially having arthritis, like we talked about last week, at earlier ages or earlier times. So anything we can do to just stave off injury or give our knees the best chance at recovering, regardless of how old the injury is, the better. So let us talk about the knee. Got a picture here of the knee for you. This is referred to as the tibiofemoral joint because it's where the tibia, that's your shin bone that you can see at the bottom of this picture, and your femur come together. So this is a picture of a knee that's bent at about 90 degrees. You can also see the head of the fibula over there on the left side. But most of them, or all of the movement is happening between the femur and the tibia. And that tibial plateau is really where knee magic, we'll say, is happening. It is, the knee is a modified hinge joint, meaning that it can really only move well in one direction, just like the hinge on a doorway. But of course, you know, your body is like, why do it exactly the same as I did it last time? So there is rotation possible at the knee, and your tibia can rotate independently of your femur. And you know this to be true. If you sit down with your knees bent, you can rotate your feet in and out, and that's not happening from the ankles. That rotation is actually happening at the knee joint itself. Thanks for those of you who are tuned in today. Make sure you give me a thumbs up to let me know you're here. Also interested if any of you who are tuned in today have had a knee injury and perhaps an ACL injury. So let me know. Just drop your comment into the comment box below. So knees can rotate, which is where we start to get into trouble. And the purpose of ligaments and the meniscus, which you can also see in this picture, the meniscus is that thin, I don't know if my mouse shows up, but that thin kind of pillow that sits between the femur and the tibia. And the purpose of the meniscus is to increase the surface area of the joint. If you just had two bones sitting on top of one another, it's not as deep, or there's not as many contact points, we'll say, which is where the meniscus comes in. It increases the amount of contact, it increases the surface area, and it also serves to cushion and lubricate movement. So again, you don't have just bone on bone. The ligaments serve to stabilize the bones to one another. We have a couple different ligaments here that we will get into. There are 4 within the knee, and you can see them in this picture as well. So we'll start on the far left side of the image. So this is a right knee that you're looking at. And the far right side of the image is the outside of the knee, and there is the lateral collateral ligament. So this is the ligament that really stabilizes the femur to the fibular head. And as you can kind of see from the picture, it's not hanging out there, but it is not connected to any additional structures, which is in contrast to the MCL, the medial collateral ligament. So the LCL, the lateral collateral ligament, is on the outside of your knee. Then if you bring your focus to the right side of the image, this is the inside of the knee, and that is the medial collateral ligament. Now, the interesting thing about the medial collateral ligament is that it is connected and attached to that medial meniscus, which is why that unhappy triad that I mentioned at the beginning can happen, because the MCL and the medial meniscus are fascially and they are connected almost like they're one and the same. If you injure the medial meniscus, it's very common to also, if you injure the MCL, it's very common to also injure the MCL because of that connection. All right, Ethan, you said you haven't actually injured your knees, but have sublexed them for a moment, just simply trying to pop them through, creating a bit of internal rotation to open up the joint. Oh my gosh. So we got some joint laxity here. And of course, you are such a body nerd. Ethan says it was actually kind of cool being able to feel my femur slide over the meniscus. You are such a body nerd. Ideally, we want our joints to have stability, because if you have some laxity in the joint, just passively, the chances of you being up and around, doing a quick movement, the possibilities of injury are a little bit higher if the joint is lax. So strengthen those quads, those calves, the hamstrings, which I know you do all of those things. But interesting. Yeah, let me guys know what other knee issues you have going on by just popping it down into the comments below. So you have the lateral collateral ligament, the LCL, on the outside of the knee, and the medial collateral ligament on the inside of the knee. But where fun really happens is deep inside the knee with the ACL and the PCL. So we'll start with the ACL first. That's called the anterior cruciate ligament. And anterior because it's in front of the other ligament that's there, which is the posterior cruciate ligament. And the two ligaments, you can kind of see them in the picture. And let me just blow myself up here. Whee, I'm bigger. Okay. They cross, and this crossing makes them stronger. And so that's what provides the stability of the knee. When your knee is straight, it is very stable. That's what's called a locked position. And both the ACL and the PCL are taut at that end range of knee extension. It's called a closed pack positioning, And so when the knee bends, there's some slack in these ligaments, which is why, again, planting and cutting when the knee is bent is a more common mechanism for injury. So let's go back to the anatomical picture to look at that. So you can see the ACL in the front and the PCL in the back. And their role is to really limit the movement or translation of the tibia to the femur. So the anterior cruciate ligament limits that forward or anterior translation so that you don't stop and your thigh bones or your shin bones keep going, and vice versa. So they do serve a purpose for sure. Now, if you have injured your ACL, you probably know. When I was working as an athletic trainer at university, it was really interesting when, athletes would come off the field and they'd say, something happened, I'm feeling this. Majority of the time, they would describe exactly the injury that had happened that we wouldn't know until imaging. But I remember a student athlete coming off the court and saying, I just feel like my ACL is shredding. And sure enough, that is exactly what had happened. And that was shown on the MRIs. So trust your intuition. If you think that something's not right, you're probably right if you think something's going on. But here's the thing about the ACL. So changing direction rapidly, like that plant and cut, which we've talked about already today, because the ACL and PCL are taut when the knee is straight, but you don't play sports with your knees locked. That just is not how sporting events go. I can't tell you how many times my soccer coach was like, get off your heels, Ellis. And I was like, yes, okay, sorry, sir. All right, so knees are usually bent and you're in that bounced position, and this is where the knee is not quite so safe, which is where you need to rely on better movement and strength of the surrounding tissues. It's not really the job of the ligaments to support your joints at all times. Yes, they are there, but they need support and backup from your myofascias, the muscle and the fascia, and the other soft tissue structures. So changing direction rapidly, stopping suddenly, slowing down while running, just anything where the tibia and the femur are possibly moving in different directions from one another. Landing from a jump incorrectly. There was a football player, I want to say maybe 2 years ago, and you guys probably know better than I do. I want to say his name was like RK3 or R3 or something like that. He was in the Subway commercials and in the Subway commercials, he's a basketball player, I think. Maybe. Anyways, in the commercials, he was jumping, and you could see that his mechanics were just setting him up for an ACL injury, because every time he landed in the jump, his knees moved towards one another, putting that extra pressure on the MCL and creating that instability for the knee. And sure enough, in the regular season, he ended up tearing his ACL and MCL and getting that injury. And then there's also like the freak accident of a direct contact or collision, like in football where somebody lands on your knee, or soccer or something like that. And that can also create, an ACL injury. I will talk about why women are more likely to have ACL and knee injuries than men in just a second. Now, how do you know that you've injured it? Just like I mentioned, you're going to know. A loud pop or your knee goes out, pain and swelling. Within 24 hours, that knee is most likely going to balloon up. The swelling might resolve on its own, but there's going to be some instability in the knee because of that ligament change. A loss of full range of motion, tenderness along the joint line, discomfort while walking. This is definitely something you want to go and get help with right away. Oops, sorry, I'm just knocking stuff on my computer here. Don't dilly-dally. But then, do you need surgery? I have some thoughts on that. I'll talk about in just a second. So why are women more likely to suffer from ACL and knee injuries? Well, here you go, right here, you guys. It's called the Q angle. And the Q angle is the angle made when you draw a straight line through the femur and a straight line through the tibia. So you can see those dashed lines and it's the angle between the two. And so because of our wider pelvis, women tend to have a greater Q angle than men. And that greater Q angle means that there's more pressure potentially on the MCL and the knee. There's just more of that potential for, a medial movement or an inner, like the knees dropping in and collapsing in towards one another than there would be for a man. That's not to say that men can't injure ACLs, right? Rob Gronkowski, Tom Brady, they've all done it. It's just that for women, we have a higher potential to do it because of our structure. Now, this isn't just like, oh, well, you're a woman, it's just going to happen. You can absolutely strengthen the soft tissue surrounding the hip, the knee, and the ankle so that your ligaments have that stability, so that you have better movement and proprioception, and possibly prevent that from happening. I am in the camp of, knee injuries that happen just from poor mechanics are, for the most part, if you put the time and effort into working on it, could possibly be avoided. No, you're not going to be able to avoid a 400-foot, linebacker falling on your knee. But if you just, have weak hips, there's things you can do to help prevent knee injuries. Now, if you have a torn ACL or even MCL, do you need surgery? Well, it's going to depend on a number of factors. If your daily life does not require a lot of planting and cutting and, running around, if you are not a professional football player or soccer player, you may not need surgery. You will always have joint laxity, so perhaps wearing a brace around the knee will be, definitely better than sans a brace. But the surgery is not necessarily going to deal with the pain. I'm going to repeat that. Surgery is not always going to deal with the pain. Surgery will improve the stability of the joint, but now you also have a ton of scar tissue that needs to be addressed from the surgery. You have all of the time that you spent off of your feet because you were on crutches from surgery. And the rehab for knee surgery and ACL recovery and repair takes 2 to 9 months. So if you're like, well, I know I tore my ACL, but it doesn't really hurt if I wear a brace, I'd say skip it for as long as you can, because having somebody cut into your body while you are still alive, it has ramifications that might not be worth it. All right. So injury prevention, what can you do to keep your joints nice and healthy? Be strong, but also be mobile. So do things like rolling out your quads, rolling out your hips. Maybe not always the IT band, but learning how to squat properly. And I will post my video in the comments about how to squat like a boss. So you can learn how to do that. And that squatting carries over into lunges, running, jumping, anything that you're doing within your movement practice. But having tissues, connective tissues that are strong, but also resilient, I would say is the word, so that they can move with you, but also be strong when they need to be, is going to be your best defense against knee injuries. Work on stability, work on balancing. I'll post a link in the comments below also for my guide about how to help your cranky IT band. This will certainly, the exercises and tips in there will absolutely also help to support and stabilize your knees. Okay, so healthy knees for life. Let's do this. We've had 2 weeks of knee stuff. Hopefully you guys have a little bit of a jumping off point with good form about what to do for your knees. If there are any additional questions that you have about your knees, please put them down into the comments below, and I'll be sure to answer them, if not here, in a future episode. And next week, I'm talking about how massage works. So come on back next week if you want to learn what you're actually doing with your foam roller, what you're actually doing with your therapy balls, how it is affecting your body. All of that will be covered. Okay? As always, keep it nerdy, stay classy. I'll see you guys next Wednesday at 3:15 p.m. Pacific Standard Time for another episode of Anatomy with Alex. Take care, and I'll see you next time. Bye!